Can I ask what your response would be to the Prime Minister if he, as expected, announces the end to self-isolation of COVID in England? And can I ask if you've had any discussions with him prior to this announcement, or Michael Gove?
I've not had any discussions directly with Boris Johnson. I've had several discussions in recent days with the UK government. I've spoken to Michael Gove just this morning, actually, and it was my most recent conversation. It's up to Boris Johnson to decide what he thinks is right for England. I will set out the update to the Scottish Government's strategy tomorrow in the Scottish Parliament, and I think there will be a lot of optimism in that strategy. We are on a journey back to normality, and we will set out the next steps in that. We want to not just get back to normality, but be able to retain a sense of normality. But we have to recognise that as we do that, COVID is still there, it's still circulating. Cases are still quite high. We know from bitter experience in recent times that new variants can come along and challenge us all over again. So as we get back to normal, we need to also remain vigilant and be prepared to take sensible steps to try to limit the risk that the virus poses. Now, isolating, staying at home for a few days if you test positive for the virus is one way of doing that, because it means you're not going into workplaces or shops or restaurants and potentially infecting other people. Self-isolation also makes those who are more vulnerable to serious illness from COVID feel a bit more confident about going out and about, because they're more assured that they're not going to be positive people around them. So I think isolation still has a part to play. Similarly, testing. We are going to migrate over the next few months, I'm sure, to a situation where we use testing on a more targeted basis. We need to have, a good remaining infrastructure to support surveillance and contingency planning, outbreak management, but we will move to a more targeted way of using testing. The question is, do we do that suddenly and take away access to free tests right now, or do we do that on a phased basis? And I'm much more of the school of thought that we do that on a phased, careful basis. While COVID is still circulating at the levels it is, I think allowing people who've got symptoms access to PCR testing, enabling people to use lateral flow tests regularly if they're asymptomatic, all that is an important part of making sure we contain COVID so that we can get back to normal and stay there.
Just on testing, if free testing is scrapped in England, will the Scottish Government, even if you wanted to keep free testing here, would it come to the point where you would be unable to, given the budget constraints set by the UK Treasury?
Well, these are decisions that we will have to arrive at over today and tomorrow before I set out the position to the Scottish Parliament. We are back again, being really starkly reminded of this illogical position that the Scottish, Welsh and Northern Irish governments have to deal with, which is that we are responsible for public health decisions in our own countries, but it's the Treasury who makes the funding decisions, and they seem to be only triggered by the decisions Boris Johnson makes for England. That's, it's unsustainable, unacceptable, but that's the situation we're in. So one of the questions that we are hoping to have answered today is what the remaining funding for testing is going to be. Presumably England is not going to take away its testing infrastructure completely, so what the residual funding will be, what that then enables the devolved administrations to support. I hope we get clarity on that later today. It would be unacceptable now, as it has been in the past, for the decisions that the Scottish Government or the Welsh or Northern Irish governments think are right for public health reasons are constrained because of decisions on funding that the Treasury are taking only on the basis of what is decided for England.